In 1860, in Baltic Sea region of Germany, doctors and nurses were busy providing mental health treatment to hundreds of women every day. However, the method of treatment wasn't medicine or therapy. Instead, the predominantly male doctors chose to treat these women by inducing orgasm. Today, through the history of vibrators, we will take a look at how women's mental health has been mistreated for thousands of years, leading to 1 in 5 women suffering from mental health concerns. In ancient Egypt, around 1900 BC, people believed that if women's wombs weren't continuously satisfied with sex or impregnation, the uterus would wander to other parts of the body, thereby causing a host of mental health problems. This theory is mentioned in Kahun papyrus written in ancient Egypt. Eventually, this theory led to the use of word hysteria as a catch-all diagnosis for women's psychological and physical health issues. Hystra means uterus in Greek. From there came hysteria, a term used to describe uncontrolled emotional excess. In ancient Greece, around 400 BC, almost 1623 years ago, Hippocrates, the father of modern medicine, believed that women's hysteria was caused by wandering uterus. According to Hippocrates, the uterus had a mind of its own, which goes for a post-dinner stroll, compressing other organs and causing hysterical attack in the women. His solution was simple. It was to place some good fragrance near the female genitalia and give her something unsavory to eat, as it would tempt the uterus to return to its normal position. Now, if you thought that was bizarre, wait until you hear what others believed. Galen, a Greek physician born in 129 CE, thought it was all about retaining female seed in the womb, which caused anxiety, insomnia, depression, and various other issues. He attributed it to the retention of menstrual blood and believed that sex could cure it all. He also believed that widows were more prone to hysteria because they could not have sex, and fluid was retained within the uterus. Unless released, as it happened in the case of males, tension would build up, leading to insanity. But what if marriage wasn't an option? That's when pelvic massage came into play. In the 16th and 17th centuries in Europe and America, hysteria was still believed to be due to retention of humors or fluid in the uterus, sexual deprivation, or the tendency of the uterus to wander around the female body, causing irritability and suffocation. Self-treatment such as masturbation was not recommended and was considered a taboo. Marriage and regular sexual encounters with a husband were still the most highly recommended long-term course of treatment for women with hysteria. It was believed to purge the uterus of any built-up fluid, and semen was thought to have healing properties. In this model, ejaculation outside the vagina was considered conducive to uterine disease, as the female genitalia did not receive the health benefits of male emission. Some physicians regarded all contraceptive practices as injurious to women for this reason. But what if marriage wasn't an option? That's when the things got a little, well, hands-on. Enter uterine massage. Uterine massage involved, well, you can probably guess. It was a paroxysmal conversion in the name of the treatment, and yes, we now call those orgasm. But here is the kicker. Doctors were so afraid of this being seen as sexual that some advocated hurting the patients to make it look like a treatment. Unbelievable, right? And that brings us back to the German clinic we started with, where pelvic massage and vaginal massage were pioneered by Swedish obstetrician and gynecologist Theo Brand, who began treating women in 1860. The Brand method of pelvic massage and manipulating the womb proved very popular and was widely reported at the clinic. Brand's clinics were a sensation, treating as many as 117 patients in one day. They used techniques that were, well, let's say, physically exhausting for the doctors, whose fingers and wrists hurt and got tired from inducing paroxysmal conversions, aka orgasm, in these hysterical patients. These treatments were far from empowering. Women were subjected to invasive and uncomfortable procedures, and they suffered in silence. Imagine going to a doctor thinking you are sick only to be subjected to treatments that were not just ineffective but downright uncomfortable and demeaning. Now, fingering and hand massages were getting tiresome for the doctors. So they created stimulation devices to replace these hands-on treatment, and that's where the vibrator came into play. Dr. Joseph Mortimer Granville, a British physician, invented the hand-cranked electromagnetic vibrator known as Granville's hammer. In 1880, the original device was invented for treating male muscle aches, but was also used for treating hysteria, tilted uterus, and nymphomania. Today's vibrator, used for pleasure by self-empowered women, was originally designed to give relief to the tired wrist and fingers of the doctors. Now let us see how Theo Brand used his vibrators that helped him establish a highly successful business using vibrators to treat hysteria. The New York Medical Journal of 1876 was one of the many journals that described the technique in some detail. Brand claimed that this method of treatment is useful in prolapses and protrusion of the uterus and several other female conditions where the uterus had moved from its position. One of the Brand's many followers were Dr. Robert Ziegenspect. In 1898, he provided detailed instruction for the internal massage in his book, Massage Treatment in Disease of Women, for practitioners. He advised physicians that if any abnormal women experience sexual irritation during one of these completely innocent procedures, they should try increasing the pressure a little so that a real pain is caused. The question which still needed an answer was hysteria actually a gender-specific disease found only in women, and whether it was a disease of sex-deprived women? In 1880, a French physician named Jean-Martin Charcot, who is also called the father of modern neurology, took a more scientific approach to hysteria. He used hypnosis to cure patients instead of any physical or sexual method. He conducted research on hysterical patients at the Salpetriere Hospital and helped differentiate hysteria from other neurological disorders. His most famous patient was Louise Augustine Glazes. She was publicly exhibited by Dr. Charcot and photographed as a patient of hysteria, which was demeaning for any woman. One of his most famous students was none other than Sigmund Freud, an Austrian neurologist and the founder of psychoanalysis. Freud, working with his partner Breuer, developed Charcot's theory further and wrote several studies of female hysteria from 1880 to 1915. Freud believed that hysteria was a result of psychological scar produced through trauma or repression. It was no longer about wandering uteri or retained fluids. But let's not forget that many women were misdiagnosed as hysterical for any mental health concerns by then. They were treated with pelvic massages and vibrators, sometimes even hurt on purpose. Unbelievable. So in conclusion, it took until 1980 for hysteria to be removed from the official diagnostic and statistical manual of mental disorder. Yeah, 1980. But let's remember this chapter in history and how it exploited women, showing that women's health wasn't always a priority for powerful men. So here is to empowering women and leaving these bizarre hysterical ideas in the past. But let's fast forward to the 20th century. Studies gradually began to demonstrate that hysteria was not exclusively a female disease. This allowed for stricter scientific view to finally prevail, challenging the gender bias that had plagued the understanding of mental disorder. And as we have delved deeper into the 20th century, the importance of transcultural psychiatry became evident. It helped us understand the role of environmental factors in emotional evolution and behavioral phenomena and how they could modify psychopathology. These studies led to the hypothesis that environmental factors, including cultural influences, played a significant role in development and expression of mental disorder. It challenged the narrow view of hysteria and opened up new avenues of understanding. So in conclusion, it took time, but we finally started to break free from the pseudo-scientific prejudices that had plagued our understanding of mental disorder, especially in women. Here is to empowering women and leaving these outdated biases in the past. Till I meet next time. Have a good week ahead. Bye-bye.